Harold Shipman, full name Harold Frederick Shipman, was born in January 1946 to a poor working-class family in Nottingham, England. Growing up beside his mother who suffered from lung cancer, he was always in an unstable emotional state. From a young age, Harold was known for his intelligence and passion for medicine, largely due to frequently witnessing his mother receive morphine injections to alleviate her pain. After his mother passed away, driven by strong determination, Harold was accepted into the University of Leeds School of Medicine and began his career as a family doctor in Todmorden, Lancashire in 1974. Unfortunately, the psychological impact from his childhood led Harold to self-medicate with the painkiller pethidine, developing an addiction, and he would often write false prescriptions to obtain large quantities of the medication for personal use. In 1975, he was discovered by colleagues and faced disciplinary action, including suspension from practice and mandatory participation in a substance abuse program. Later, Shipman was hired as a doctor at the Donnybrook Medical Center in Hyde. He worked diligently and earned the trust of his colleagues and patients. Concerns about Shipman's practices were later raised when a local undertaker noticed a pattern among his patients, including rapid deaths and neat clothing. When the undertaker expressed his concerns, Shipman reassured him that there was nothing to worry about. Shortly after, a colleague of Shipman's, Dr. Susan Booth, also noticed similar irregularities and reported them to the police. A secret investigation was conducted, but Shipman maintained his professional demeanor. Further investigation revealed discrepancies in patient records, including altered medical histories and causes of death. Due to the complexity of Shipman's practice as a family doctor, investigators faced challenges in determining the scope of his actions. Shipman denied any wrongdoing. The case against Shipman gained momentum when Angela Woodruff, the daughter of an 81-year-old patient, questioned the explanation provided by Shipman regarding her mother's death. Shipman advised against an autopsy, citing the patient's wishes to be buried and mentioning a will that left a significant portion of her estate to him. However, as a lawyer familiar with her mother's intentions, Woodruff found this suspicious, particularly given the presence of her forged signature in the will, leading her to question the authenticity of the documents and the circumstances surrounding her mother's death. Mrs. Grundy's body was exhumed for investigation purposes. The forensic doctors concluded that she died due to an overdose of morphine, which was administered within 3 hours prior to her death, coinciding with the time frame when family Dr. Shipman visited her. The police subsequently conducted a search of Shipman's residence and discovered numerous patient records, jewelry, and homemade medical equipment. Further investigation revealed that Shipman often suggested cremation to the families of his patients and had meticulously prepared documents and computer records to avoid suspicion. However, he failed to account for the fact that each time he altered the records on his computer, the edit history was preserved. This led the police to uncover his actions. The investigation expanded to include the exhumation of several bodies, and it was concluded that Shipman was linked to 15 counts of murder and several instances of falsifying records. The first trial of Shipman took place on October 5, 1999, related to the death of Mrs. Grundy. Subsequently, the doctor faced multiple trials. On January 30, 2000, Shipman was sentenced to life imprisonment without parole after a jury concluded that he had intentionally killed 15 patients. Mr. Richard recounted, Shipman was arrogant, dismissive of others, and felt insulted when questioned by a junior detective. He genuinely believed his status as a doctor warranted interrogation by a higher-ranking officer, and throughout the questioning, he treated the investigators as if they were intellectually inferior. Even during the trial, he was convinced he would be acquitted. He exhibited a high degree of delusion, excessive self-confidence. It was clear that he not only enjoyed the sensation of killing, but also derived excitement from manipulating the victims' families. In June 2003, Shipman was transferred to Wakefield Prison. On the morning of January 13, 2004, he was found dead, having taken his own life by hanging. One day before his 58th birthday. Mr. Richard described Shipman's death as a calculated act, rather than a remorseful one, aimed at increasing the pension benefits for his wife. Shipman had been stripped of his NHS pension by then Health Secretary Alan Milburn after being convicted of murdering 15 patients in 2000. However, his wife would be entitled to a widow's pension if he died before the age of 60. If he died before 60, his wife would receive a lump sum of around £100,000 and an annual allowance of £10,000, whereas if he died after 60, the figures would be significantly lower, at £5,000 per year. The then Chief Constable of Greater Manchester Police, Michael Todd, was reportedly furious upon learning that Shipman's suicide in 2004 had financially benefited his wife. According to the findings of a 2004 investigation, Shipman took the lives of at least 250 patients. However, the actual number could be as high as 1,000. Harold Shipman is remembered as one of the most notorious serial killers in history.